sympathetic innervations of the eye. Here we will see sympathetic and adrenergic receptor and their pharmacological effect in the eye. Let us see. The first one is alpha. Alpha-1 adrenergic receptor located in the radial muscle of the eye. This is the radial muscle. And stimulation of radial muscle of eye leads to contraction. And contraction of radial muscle leads to mydriasis. That is increase in pupil size. The drug used is phenylephrine, generally 2.5% phenylephrine solution used in the form of eye drops for the mydriasis effect. Where it is used, the therapeutic use of phenylephrine is fundoscopic retinal examination and cataract and intraocular surgery. So alpha-1 adrenergic receptor activation leads to mydriasis. Next, alpha-2. Alpha-2 adrenergic receptor located in the eye. Effect of activation, it causes reduce or decrease in aqueous humor production. And if the aqueous humor production is decreased, it may help to decrease or reduce the intraocular pressure. And if the intraocular pressure is decreased, this mechanism is useful in the management of glaucoma. In the glaucoma, intraocular pressure increases. The examples of drug, apraclonidine and brimonidine. Therapeutic use in the treatment of glaucoma where intraocular pressure is already increased. And what is our goal? We need to decrease it. And second one, inhibition of perioperative intraocular pressure increase. If the IOP is increased before the surgery, so to prepare the eye for surgery, we need to decrease the intraocular pressure, and in this case, we need to use apraclonidine or brimonidine eye drop. Now here, we mentioned that aqueous humor production. We should know that what is the importance of aqueous humor. The aqueous humor is a clear watery fluid that fills the anterior and posterior chambers of the eye, the space between cornea and lens. And it is very important that this aqueous humor is responsible for the maintenance of intraocular pressure, which is normal between 10 to 21 millimeter of mercury. It provides internal pressure that maintains the shape of eyeball, ensures the cornea and lens remain properly positioned for accurate focusing of light, and if there is imbalance between formation and the drainage of aqueous humor leads to glaucoma, we can say increased IOP, intraocular pressure. Next one, beta receptor in the eye. Beta 2 adrenergic receptor located in the eye. ciliary epithelium of the eye. Effect of stimulation, it leads to increase in aqueous humor production. See, this is the contrast as compared to alpha 2. Alpha 2 adrenergic receptor decreases the aqueous humor production, while beta 2 adrenergic receptor increases the aqueous humor production. And if the aqueous humor production is increased, that increases the intraocular pressure, and if the intraocular pressure is increased, that may worsen the glaucoma, and therefore this activity is not useful clinically. So beta 2 adrenergic receptor agonist not used in clinical practice because activation leads to increase in the aqueous humor production, which increases intraocular pressure, and that may worsen the glaucoma. Now, which are the alpha 2 adrenergic receptor drug? Albuterol, or another name is salbutamol. The patient of asthma, they are taking albuterol or salbutamol for the management of bronchoconstriction. If it is taken by the inhalation, it's okay. But systemic or oral route of albuterol may leads to increase in aqueous humor production. And this is the side effect of albuterol. And if the patient of the glaucoma, we need to take care while prescribing albuterol or salbutamol by systemic route. Now, if the aqueous humor production is increased due to beta adrenergic agonist drug, how to manage? We need to give beta 2 adrenergic receptor antagonist. This is the beta 2 adrenergic receptor antagonist, and the most commonly used drug is timolol. The timolol is non-selective beta blocker. It acts on both receptor beta 1 plus beta 2, and it decreases the aqueous humor production by acting on beta 2 adrenergic receptor in the eye, ciliary epithelium of the eye, that leads to decrease in intraocular pressure. What is our therapeutic goal here? To control the glaucoma. Why glaucoma? Glaucoma is due to increase in intraocular pressure. So we need to decrease intraocular pressure. And second name is that ocular hypertension. If the patient has ocular hypertension, then we need to give timolol. So these are the sympathetic innervations of the eyes.